Hello, we are doctors from Hospital University Science Malaysia. Today, we will demonstrate on how to perform bedside examination of taste. In general, there are 4 basic steps that we can follow in order to perform bedside examination of taste. We can start with introduction, inspection, performing taste examination, and interpretation of the results. For the first part, which is introduction, introduce ourselves to patient. Explain regarding procedure that we are about to do. We must ensure that patient is comfortable, did not smoke for at least 1 hour before procedure, and also did not eat or drink for at least 30 minutes before the procedure. It is better for patient to cleanse their mouth prior to examination. Hello, good morning. My name is Dr. Iskandar. Can you please say your name?
My name is Imran.
Okay, Mr. Imran. Today we will perform bedside examination of taste. Are you comfortable?
Yes.
That's good. Did you smoke, drink or eat for the past few hours?
No.
That's good. Have you cleansed your mouth?
Yes.
Okay, then we shall proceed.
Sure.
With me, there are 6 bottles of testing material. I will place one at a time to either side of your tongue for you to taste. Once you're able to recognize the taste, hold up your left hand and point on the taste card using the stick. You must make sure throughout the procedure, you keep your tongue protruded. Okay? Can you please face forward and open your mouth? For the second part, which is inspection, we need to observe for any facial asymmetry or swelling. While inspecting in the oral cavity, we must carefully observe for any abnormalities at the level of teeth, gums, or oral mucosa. Before we perform bedside examination of taste, there are few items that we need to prepare. First one is cotton stick applicator. 4 main testing materials consist of sweet, salty, sour, and bitter. We can also test for umami if the testing material available. We must include control testing material consists of drinking water. We also need to provide taste card in order for patient to point during the examination. This taste card contain label sweet, sour, salty, bitter, umami, no taste, and not sure. Moving on to the third part, which is performing taste examination. We need to inform to patient that they need to remain protrude their tongue throughout the procedure. Wrap patient's tongue with gauze and hold it with gloved hands. Apply testing material with cotton stick applicator, one at a time to either side over anterior 2/3 of the tongue. It is better to alternate between testing material and test for bitter sensation last. One of the important technique is to conceal the testing material from patient eyesight, as patient might have visual cue to guess the taste based on its appearance or its label. Ask patient to indicate the perceived taste on the taste card. We can give time up to 20 seconds for patient to recognize the taste given. After patient able to recognize the taste, apply the next testing material to contralateral side. Next, I will place one at a time to either side of your tongue for you to taste. Can you please protrude your tongue? Okay, very good. Okay, very good. Very good. Okay, very good. Very good. Okay, thank you very much. Last but not least is the fourth part, which is interpretation of the result. Based on the demonstrated technique of bedside examination of taste, we can interpret that the patient might have either normal taste perception or abnormal taste perception. We can further classify that the patient which has abnormal taste perception either having dysgeusia or ageusia. Dysgeusia is defined as patient perceives altered taste sensation. For example, if we give sweet stimulant, patient might perceive the taste as sour or bitter. Ageusia, on the other hand, is defined as patient unable to perceive any taste sensation. For example, if we give any stimulant, patient unable to recognize any of the taste given. Based on the interpretation that we have on this examination, and alongside with other clinical findings, we can localize the lesion along the taste pathway at the level of facial nerve, nucleus tractus solitarius, and gustatory cortex, which is Brodmann area 43. If the patient has abnormal taste perception, further detailed assessment is needed, and also involvement of multidisciplinary team as part of management of the patient. Thank you.